Morning friends! I'm going to bring you guys to work with me today so that we can talk about taking care of post-op open heart surgery patients. I'm going to show you like the heart carts that we use, different things you have to consider when you get a post-op open heart surgery patient. And yeah, I think it'll be really interesting. I love working with these open heart surgery patients. It's a really cool thing that you can do as a nurse. So yeah, I'm going to take you along with me and talk about that today. So let's go to work. September 1st equals I can drink pumpkin guiltlessly. Thank you, Duncan. I got to work a little bit early because I wanted to stop and get this Dunkin' coffee, but now I'm at work too early. And I'm afraid to drink my coffee because I got a hot coffee and I'm pretty sure it's like 5 million degrees. So I want to take a sip so bad, but I don't want to burn my tongue. I don't want to do it. So I guess I'll just go ahead and head into work. I got a large coffee, so I think I'm going to, I just had this idea. I'm gonna pour some of it into another cup, put it in the fridge, and that way this afternoon I can make myself an iced coffee because I don't need to drink this whole large coffee this morning. So I'm gonna split it up, have an afternoon treat. Yeah, let's go ahead and go into work. This is what my patients must see when they look at me. Looks good. So I just got to work. I'm going to kind of see what's going on for the day. I'm going to write down some stuff on my patients, look them up a little bit, get a report, kind of see what the CVOR schedule looks like today, what kind of cases we have. Sometimes you'll start out with 2 patients, then you'll transfer them to step down, or you'll discharge, or sometimes you have to hand them off to another nurse if you're going to take a heart that day, because the hearts are just 1-to-1 patients for the first 4 hours. So you never really know what you're going into at the beginning of the day. So yeah, I'm going to go kind of do some investigating and see what the day has in store, and I'll check in with you guys in a little bit. I just remembered that I saved half of my coffee from this morning, so I'm gonna put it on ice. It's been a good day so far. I'm not taking a heart today, but I am taking a femimdarterectomy. So that's settled. I have a student today, so that's pretty cool. So she is watching my patient along with another nurse while I ate real quick. So my lunch is almost over. I'm gonna make this coffee. So not gonna lie, the day got away from me a little bit and I didn't film as much stuff as I thought I was going to. We ended up having, I think, 3 hearts come out and none of them were stable. Like, they were just, yeah, sometimes you get really stable hearts and other times there are not stable hearts, but it was hard because all 3 of them were not stable. So I actually didn't take a heart, but I had 2 other patients and then I got tripled with a vascular surgery. So I was very busy because 2 of my patients were on one side of the hall and then the one that I got tripled with was on the other side of the hall, and he was a little bit squirrely, I think, from the anesthesia. So I was actually really thankful that I had a student with me today because she was super helpful, and it's really just nice to have an extra pair of hands, especially when you are busy. So yeah, I did not get to film as much as I thought I was going to because I was running around like a crazy person, but all in all, it was a pretty successful day. one of my patients, the vascular patient, had a feminectomy, and they did this like shockwave therapy thing, which is new. I have not seen that before. So it like uses like, I guess, electricity to, I have to do a little bit more research on it, but uses like electricity to break up the plaque, kind of like lithotripsy. So that was interesting, getting to learn something new today. And I also learned how to call a pager today. I had to page somebody. Don't judge me, I have not had to do that before. I've called a doctor, like paged a doctor, where I like called the office and put out a call to them, but not literally like page someone's pager. So some of my more senior nurses helped me figure out how to do that. Yeah, so all in all, pretty good day, nice and busy, went by fast. I think I got a little bit of footage of setting up the heart room, but yeah, so it varies based on the surgeon, like what they want in the room. But most rooms are gonna have a at least a triple pump, because all the heart patients come out on an insulin drip. So they all have the insulin drip, whatever fluids they're on, and then the third pump is usually like a rider, like just a KVO to carry like antibiotics or the insulin. And then sometimes they will come out on like additional drips, or they'll need additional drips, so you always want to have extra pumps ready. All the rooms are going to need a we call them Vigileos, which I'm not exactly sure what they're called everywhere, but the monitor that measures like the cardiac output, cardiac index, stroke volume, systemic vascular resistance. Each room gets one of those because it's really important to monitor hemodynamics right after heart surgery. You're going to need suction setup in the room, 2 suction setups ideally, because the chest tubes are going to need to immediately go on suction for the most part. And then what else do they all get? A glucometer, you're going to need strips, and then whatever fluids that particular surgeon likes. We have actually a whole heart cart that goes into the room, which is awesome. It has like all the syringes that we need, bandages, really anything for emergencies, which is great. So we all, each room will get a heart cart, and I'm probably forgetting stuff, but like some of our surgeons will send out the patients with temp Foleys. So they'll actually, we'll have to have the cord in there to hook up the temperature. One of the surgeons likes to have a bear hugger, so we immediately put the bear hugger blanket on the patient when they come out. So it just really depends on the surgeon, but that's pretty much how you set up the heart room. And then post-operatively, when you get your patient, one of the big things is maintaining patency of the chest tubes, because you have to make sure everything's flowing, otherwise it could cause tamponade, and just bad stuff could happen. And then you need to monitor your output of your chest tubes to make sure that the patient's not like bleeding excessively. So it's really important to monitor chest tube output for bleeding, and you know, checking to make sure there's not a huge air leak or anything like that. Just keeping track of the chest tubes is really important. And then you also want to measure monitor the hemodynamics and treat accordingly. You want to monitor the heart rate and blood pressure, treat those accordingly. So really monitoring chest tube output post-op heart surgery is huge, and watching the vitals and hemodynamics. Those are some of the most important things. And then just making sure they're like waking up properly from anesthesia. Some patients will come out intubated, and we like to get them extubated within 6 hours. So if they're intubated, you have to kind of account for that, work with your respiratory therapist. And then just recovering them, weaning them off the oxygen, eventually doing a swallow eval. And yeah, I think those are some of the main points in taking care of the post-op open heart surgery patients. I hope that you guys learned a little bit from this video, and I'll try and hopefully I got a little bit of good footage for you. But yeah, so that was kind of taking along my day. I'm gonna go home now. I think Morgan is out riding his jet ski at the lake with his friends, so I can go home and shower and kind of relax a little bit, figure out what I'm gonna do for dinner. I have no idea. But yeah, that was my day. Thank you for coming along with me. Thank you for watching. Make sure to hit the thumbs up if you like this video, and click subscribe to follow along with more of my nursing journey. Yeah, so thank you guys for watching, and I'll see you next time.